cholinergic drugs or cholinomimetic, also known as parasympathomimetic. So these drugs will produce action similar to that of acetylcholine. So cholinergic drugs are also known as cholinomimetic or parasympathomimetic. These drugs will produce action similar to acetylcholine. So there are two categories in cholinergic drugs. First is cholinergic agonist. Cholinergic agonist will directly interact with the cholinergic receptors. Second is anticholinesterases. So there is an enzyme acetylcholinesterase. This enzyme acetylcholinesterase, this will degrade the acetylcholine, and these drugs which are known as anticholinesterases, it will block that enzyme acetylcholinesterase, and so acetylcholine का degradation नहीं होगा, and thus the availability of acetylcholine will increase. So there are two categories of cholinergic drugs. First is cholinergic agonist. These will directly interact with the cholinergic receptors. Second is anticholinesterases. So it will inhibit the acetylcholinesterase enzyme, which will increase the availability of acetylcholine. Now, the first category, that is cholinergic agonist, it has two type of drugs, choline esters and alkaloids. In alkaloids, we have muscarine, pilocarpine and ericoline. In alkaloids, muscarine, pilocarpine and ericoline. So pilocarpine comes under the alkaloid category of cholinergic agonist. And then choline esters, we have acetylcholine, methacholine, carbocol and बिथानोकॉल. ठीक है, कोलिन एस्टर्स में एसिटाइलकोलिन, मेथाकोलिन, कार्बोकॉल एंड बिथानिकोल. सी एसिटाइलकोलिन का प्लाज्मा हाफ लाइफ बहुत कम होता है, because they get degraded by plasma metabolism. Plasma enzymes like acetylcholine esterase या pseudocholine esterase वो इनको डिग्रेड कर देता है, तो एसिटाइलकोलिन का हाफ लाइफ बहुत कम होता है, दैट्स वाई इट्स नॉट प्रैक्टिकली यूज्ड. मिथाकोलिन, कार्बोकॉल एंड बिथानिकोल, दीज आर रेसिस्टेंट टू प्लाज्मा मेटाबॉलिज्म, तो इनका हाफ लाइफ ज़्यादा होता है. सो कोलिन एस्टर्स में वी हैव acetylcholine, methacholine, carbachol and bethanicool. And in alkaloids we have muscarine, pilocarpine and ericoline. These are cholinergic agonist. The other category in cholinergic drugs is anticholinesterases. Anticholinesterases, they will inhibit cholinesterase enzyme. कोलिन एंजाइम क्या करता है, ये एसिटाइल कोलिन को डिग्रेड करता है, तो अगर ये इनहिबिट हो जाएगा तो एसिटाइल कोलिन का अवेलेबिलिटी इंक्रीज होगा. एंटी कोलिन एस्टरेजेस आर ऑफ टू टाइप, रिवर्सिबल और इरिवर्सिबल. इन रिवर्सिबल वी हैव कार्बामेट्स एंड नॉन कार्बामेट्स. इन इरिवर्सिबल वी हैव कार्बामेट्स एंड ऑर्गेनोफॉस्फेट्स. ठीक है, तो anticholinesterase can be either reversible or irreversible. In reversible, there are carbamates and nor-carbamates, and irreversible there are again carbamates and organophosphates. See, organophosphate poisoning is seen in farmers, and these organophosphates include DFP or deflose, ecothiophyte, malathion, diazinon. Malathion and diazinon are found in pesticides or insecticides. Then tabun, sarin and soman. These are nerve gases for chemical warfare. These are nerve gases for chemical warfare. Organophosphates, these are irreversible anticholinesterases. Example, deflose, ecothiophyte, malathion and diazinon. Malathion and diazinon are seen in insecticides. Then tabun, sarin and soman. These are nerve gases for chemical warfare. Then the irreversible carbamates are carbaryl and propoxor. These carbaryl and propoxor are found in insecticides. Okay. The anticholinesterase can be reversible or irreversible. In irreversible, we have organophosphates like diflose, ecothiopate, malathion, diazinon, tabun, serine, and suman. And in carbamates, we have carbaryl and propoxor. Carbaryl and propoxor are seen in insecticides. Then in reversible anticholinesterases, we again have carbamates and non-carbamates. In carbamates, physostigmin, neostigmin, pyridostigmin, and rivastigmin. Physostigmin or eserine, physostigmin, neostigmin, pyridostigmin, and rivastigmin. So these reversible carbamates, they end with the word stigmin. Physostigmin, pyridostigmin, neostigmin, and rivastigmin. And reversible non-carbamates are edrophonium, tacrin, donepezil, and galantamine. So reversible anticholinesterases are divided into carbamates and non-carbamates. Reversible carbamates are physostigmin, eserine, neostigmin, pyridostigmin, and rivastigmin. And reversible non-carbamates are donepezil, tacrine, edrophonium, and galantamine. See, edrophonium, it is a non-carbamate. Edrophonium, tacrine, donepezil, galantamine, these are reversible non-carbamates.